Everything starts with the first link, which always begins with a long-tailed mouse contaminating a human being with its feces, saliva, and urine. What influences the spread of this pathology? Logically, climate change and the presence and changes of place and ecosystem of the rodent, which is the transmitter, influence it. The odyssey experienced by the cruise ship leads to an outbreak that is really very delicate, mainly for all the contaminated people and those who have had to live through such a dramatic situation that even ended with several lives. The same doctor from the cruise ship is hospitalized in a very serious condition. If it is true that there are some connotations that we have not yet been able to manage, such as the people who disembarked on the island of St. Helena, whom we obviously cannot find to really assess whether they are contaminated or not. The Andes variant of the Hantavirus is contagious, and in recent times, in the last decade approximately, it has been proven that it can be transmitted from person to person. That is, everything starts with the first link, which always begins with a long-tailed mouse contaminating a human being with its feces, saliva, and urine. That human being who is contaminated by the saliva particles, through coughing, discomfort or proximity, can contaminate other people. It is evidently easy to spread. What influences the spread of this pathology? Logically, climate change and the presence and changes of place and ecosystem of the rodent, which is the transmitter, influence it. What is the difference between the outbreaks that have occurred in Argentina and this one from the cruise ship? Well, they are different. That is, the largest one we have had was in 2018 in the population of Pullen, where there was a significant number of deaths. From that moment, there was quite accurate epidemiological surveillance. As for what happened on the cruise ship, it is something totally dissimilar. It is a group of people who were at a disadvantage from a health point of view and confined in a place where contamination was easier. An international outbreak of these characteristics should be investigated in the following way. For example, see where the people who acquired the disease have circulated. Secondly, catch this type of mice and investigate them to know if they are contaminated and conduct evaluations of the entire epidemiological part of the areas that may be dangerous. Are there risks of similar cases appearing in Argentina related to the ship? No, there are no such risks because there is no relationship between the journey and the territory. The preventive measures that both tourists and residents of the areas should take are fundamentally always to have the house aired, ventilated, all the grass and weeds around it cut to visualize the rodent, have the orchards or gardens away from the house and for tourists in general, not to touch, not to lift, not to try to be in places where there may be such risks that generally always indicate to us which ones they are. Is the Argentine health system solidly structured for these eventualities? Yes, it is trained and has adequate infrastructure to solve it.